It's a great honor for me to speak here today to you at the first meeting in Pakistan combining digitalization and digital therapeutics for people living with diabetes in Pakistan. It's a great honor for me. I'm Peter Schwarz. I'm professor for prevention and care of diabetes, and I'm the president of the International Diabetes Federation. And the International Diabetes Federation is a roof organization of 242 member organizations, and we are present everywhere in the world. And so, what is these strengths? Being present in every country in the world means learning from good practice, best practice examples in some of the countries and helping and to translate them into other countries. And this is what I think is this meeting is also about to think about what could be digital best practice in supporting people living with diabetes in Pakistan. This is where I would like to share some insights with you about approaches related to digitalization and approaches related to also the use of AI for people living with diabetes mellitus. I already introduced myself. Being the president of the International Diabetes Federation is something unique. And I'm passionate about to do whatever we can do to improve quality of diabetes care, especially in low and very low income countries. So now we could say, why is there a place for digital therapeutics in diabetes care? And I'm very confident that digital therapy or digital therapeutics are a new column, a new opportunity for reaching people with diabetes, for providing 24 hours a day best evidence-based diabetes care, for developing interventions to motivate, to improve adherence and compliance of people, not only to medication or therapy, but also helping them to cope with the daily burden of having diabetes mellitus. So also improving quality of life and well-being of people living with diabetes. Here's an example. Germany is in the moment the frontier of developing digital therapeutics in many facets of chronic diseases, also in diabetes. And here are 9 examples of products or apps or digital therapeutics in diabetes care. And they have a lot of different assets and strengths and weaknesses. And I don't want to go deeper into it, but what we are currently discussing depends on the experience with this digital therapies. Here are 2 apps focusing fully on management of obesity. Here's one app being dedicated fully to people with diabetes who have a depression. So they focus on the depression and not on diabetes. Mebix and Vitadio are 2 apps doing diabetes education for people having type 2 diabetes. Glucura and Una are using the glucose sensor and target nutritional intervention based on the shape of the glucose curve with the sensor. My dose coach is a bolus calculator for long-acting insulin, and Isusta is on the way to get licensed. It's an app, and so bringing all the data together for people living with type 1 diabetes. But why are they efficient? And let's use science to explain why they can be effective. This is a review of reviews discussing what is effective in behavior change. And the bold printed is important. Any successful strategy should focus on the maintenance of an effect on patient side, the frequency of contact. So as more contacts you have, as better the intervention, and social support are key for success. Where does this happen? Does it happen in the office visit of the patient for us as healthcare professionals? No, it's a daily routine of our patients. Here you see the strategies of behavior change, motivation, action, maintenance. Every one of us is in different readiness to change behavior. And understanding how ready the uh, people living with diabetes are to change behavior, this is the target for us to think about what is the right intervention. And here are interventions shown like motivational interviewing, reflective listening, open questions, change talk. And these techniques can be used based on the readiness to change behavior to target the need of the patient and to help him to move from stage to a sustained behavioral change. Again, the question, where does this happen? Daily routine of our patients. Behavior change is not happen in the office, it happens in the daily routine. Another slide showing what is actually driving our behavior change. And if you have patients who have cancer or pneumonia, they normally follow us what we tell them. But if you are talking about diabetes or obesity, it's very different. Um, the conversation with us has a sustainability from 1 to 2 days. And then the patient often has forgotten about our conversation because others become more important, and this is the peer group of the patient. So the lifestyle of the peer group of the patient is more important for the lifestyle of the patient than talking with us. We can be sad about this, but again, it shows how powerful daily routine for the quality of life is. Here, an example for type 1 diabetes patients, how often they have to do treatment decisions. And over a year, it's about 6,000 hours for a patient. It's only 18 hours or 1 hour, depends on the educational effort we are taking for us. So, who is really changing the therapy? It's the patient in its daily routine. And here you see an example of a pre-diabetic person or a nearly pre-diabetic person with a lot of fluctuations of glucose based on his daily behavior. And this is actually very interesting technology because imagine we would use the shape of the glucose curve and would understand what the patient is doing. We can use this to trigger him with educational videos, for example, for with 20 seconds, a minute, to explain him what happens and help him to change this on the next days. So we could use this as educational motives in the daily routine of our patient. But we are scientists. This is in review. 3,500 articles we have analyzed, and we looked into how digital interventions should be characterized or specified or framed to have a maximum on effect. And this is only one table out of 5 from this review. And the green arrows means significant lowering of A1C. And there is, even for all digital tools, there is a good effect on A1C comparable to oral treatment of people living with diabetes. Again, the power comes from the daily routine. So if you try to sum this up, there is good evidence that we should act in a digital, with a digital motive to reach our people living with diabetes, but also our guidelines since 5 years. This is a guideline from 2019. Say we as healthcare professionals should know about apps in the diabetes sector, and we should know their strengths and weaknesses, and we should use them for lifestyle intervention and diabetes management, and we should use the data to improve the outcome. So this, I like to ask who of us or whom of us is doing this. Many are not. And this is something we can change. And I hope that this meeting today will initiate in thinking about how you also might change this in Pakistan. Here you see again how all drugs lower A1C, how lifestyle is lowering A1C, and here how digital tools are lowering A1C. All digital tools, these are maybe Skype-based sessions, medium, all the digital tools, this have been SMS intervention for the patient, and young digital tools. And what are young digital tools? These are smartphone-based apps. And now you could say, how can a smartphone-based app lower the A1C so strong? This doesn't work. The answer is very simple. We are in the pocket of our patient. We never have been so close to our patient than being in the pocket. So now thinking about this power and knowing that every one of us is taking 1,800 decisions a day, 450 of them are related to our lifestyle. So we could develop tools, digital therapeutics in the pocket of the patient, giving in the right moment with the right motivational strategy, with the right content, impulses only to influence 10 out of the 450. But over 1 year, we may translate this into 10 kilogram of weight reduction. So modern diabetology easily could look like this. And I think we should not fear this. We should support this. We should actually push this. We should make it to our tool, what we are using to help our people living with diabetes to cope with the disease. Again, an example from Germany. This is one app doing diabetes education and using cognitive behavior change therapy as a baseline for the app in supporting the patient for with educational motives. And also using AI and analyzing the food of the patient and use this to help the patient to manage the diet. There's another one, even being more advanced than using AI, and you make a photo from your food and it's qualifying and quantifying what you are eating. And this is then used not to blame the patient for what he is eating, but the information is used to help him that the next meal becomes more healthy. Other apps using the sensor and using the change of the shape of the sensor curve for nutritional coaching. And again, here also using strategies of cognitive behavior change as a baseline for performing the intervention. But I think we have to go further. AI already becomes generative AI, so AI learns from himself, and this, I think, will be disruptive if you are talking about the diabetes sector. There are a lot of explanations and a lot of views onto AI, what it is and what it can be used for. And if you are looking into the diabetes sector, there are many applications where we can use AI to help us or to help our patients to improve coping with the disease or to actually improve the quality of diabetes care delivered in the last mile of the care process. There are many applications which we can use AI for research, for improving the process of care, improving quality of care, but also improving the delivery of diabetes care. But there are also downsides. One downside for me is Google tells me that 85% of the content in the internet, health content, are wrong. So AI is using this to learn from it, and this is still a challenge, and we have to cope with this. And I had the chance to lead a forum building guidelines for the use of AI. First, it has to be patient-centered, patient-centered, patient-centered. So the power of AI we should first use to improve the delivery of quality of care to our patients. But we have to use it. We have to be empowered to use it and to shape the quality of AI. And this needs regulation. Yeah, remember the 85% wrong content. This can be a risk for our patient. So building strong regulation can be to secure that there's no risk. And this is again also our obligation to collect data, to do studies, and to better understand what are the key points and the trigger points why AI in the medical sector is efficient. And we should collect this data on a large scale to become ourselves better and better to give the right tool in the right moment to the right patient. Here again, an example. I apologize for the slide on the wrong position of an AI-based tool analyzing food fully automatically for the patient and helping the patient to improve his dietary behavior. And another one using this sensor, it's a Swedish development, and this sensor reading are compared with a swarm of 1,000 patients also using the sensors. And then the AI-based app understands and learns the lifestyle of the patient and uses this to make very precise treatment recommendation for the patient. This app tells the patient today, 6:35, you should inject 22 units of long-acting insulin. So it's a diabetology out of the pocket of the patient by revolutionizing the analysis of 1,440 data points about tissue-based glucose from the sensor reading. So there are developments, especially in your region, where AI-based tools are developed, will help the patient to cope with his disease, where the patient can use WhatsApp to talk to AI-based tools, and they help him to interpret glucose reading, sensor readings, to help him for lifestyle intervention, but also identify risk and tell the patient when is it the right moment to go to a physician colleague. This is Madhu, developed by a network of physicians, Dr. AI in India. And Madhu is something what is used in multiple languages worldwide already for the patient to improve his understanding about the disease. So it's worth to download Madhu and to work with Madhu also in your practice. So the challenge in the future is who's better, the AI-based brain or our brains? And I think we have to learn to accept that there are aspects where AI is very cool, where is very good, and we have to define our role. And I think we have a very important role. And our role, in my eyes, is mainly that we have to be the teacher of the AI-based tool. Going further, there will be digital biomarkers. And if you analyze today the shopping behavior online, you can identify the start of hyperglycemia ahead of the start of hyperglycemia. So 10, 15 years earlier than we diagnose diabetes in a medical setting. Should we use this? And from my side, a clear yes, we should. If we can improve quality of care, we should use this. Here are examples of digital biomarkers, but imagine we would have a lot of digital biomarkers, and the first step is to put this data together for the patient. This is what all the digital therapeutics are doing. It's fine. We visualize it, and to give the patient education to better understand it, I think everyone would say it's fine. If we then use this for prevention, everyone would say this is fine. If we then go into diabetes education, it's becoming a little bit more complicated because in some countries in the world, diabetes education is a strong asset. So people might say, oh, we don't want to give this to an app, but I think we should because AI-based tools can be very precise and good if the content, if the delivery of the content is good. And if we accept this, we are very close also to do treatment. And I think we should not fear that modern diabetology might look like this. And you might say, no, we don't want this. But I think, yes, we want this. If you think about Rwanda, there's 380,000 people living with diabetes and not only one diabetologist. Finally, I'm the president of the International Diabetes Federation, and serving IDF for means addressing the need of people living with diabetes. This is what is driving me. And this varies a lot in different countries. So we have to address a varying need. Again, this could be something where digitalization, especially AI, generative AI-based digitalization, can be very powerful. And I think the International Diabetes Federation must be a very strong and powerful voice for the right of people living with diabetes, because I truly believe that every person has the same right to get the same quality of diabetes care. And in the future, digital therapeutics are part of this. And we should make sure that there's also a same accessibility and availability of high quality of prevention and care for people living with diabetes. I have three goals. One is being in the brain of every healthcare politician, being in the pocket of every diabetes patient, and being in the heart of every healthcare professional treating people living with diabetes. First, we will develop a global diabetes index once a year to assess the quality of diabetes care everywhere in every country in the world and reflect this before World Diabetes Day for free to anyone who wants to use it and want to build a momentum to use digitalization to build a momentum to improve the quality of diabetes care. Secondly, in the pocket of every diabetes patient. And who is in the pocket? It's Google, Meta, Alphabet, and working with them to build a freely accessible diabetes education program is one goal of the International Diabetes Federation. And thirdly, in the heart of every healthcare professional, building a fellowship program. So you sitting in the room, I invite you to become fellow of the International Diabetes Federation. Since a few days, this fellowship program is open. You only have to register, upload your documents, you have to pay something, but what you pay will be deduced for any of the IDF congresses, and you get free access to the IDF School of Diabetes, which we want to leverage in the next months to more than 1,000 modules covering everything in diabetes care. So this fellowship program will be our global community of people being passionate for quality of diabetes care. So if you have your smartphone in your hand, use this moment and scan this QR code. You come to a WhatsApp channel from myself, and I'm using this channel to report about IDF activities and will launch also the fellowship program in the next days. And this will be also your way to witness these activities, but also to keep contact with me and comment on these activities. So to build this community of people who are passionate about quality of diabetes care. I'm also inviting you to come to Bangkok on the 7th till 10th of April, our next World Congress. And we exactly these topics we will discuss there largely at the Congress. There are many faces of people living with diabetes. Let's use digitalization to provide a better care and put a smile on the faces of people living with diabetes. Again, some social media channels, which you also can follow if you prefer some of them. It is used that you witness the activities and can keep contact with me and comment on the activities we are doing. Let's use all our intuition, all our ideas, all our passion to bring this together to build a global community, but finally help our people living with diabetes to walk away from diabetes. Thank you very much for your attention.